Dysplasia, 440. There just aren't many reported cases that are...
It's that rare, huh?
Pretty rare. Let's see, my tricuspid dysplasia. Retrievers, that's where I've seen it most.
Mm-hmm.
She's like, I will destroy you.
There it is.
So cute. There we go. She was really good. Oh, yeah, she was. And she was starting to fall asleep. Oh, well, you're not anymore, baby.
So even though the right atrium is large, because the leaflet's closed in a more apical location, neurotrichus is not always severe. Alright, that is what June says about it. Let's see what Sisson says about it.
Can't play though. Like, I will sure. She's like, I will call you to these little big nails.
She just had it done on Friday too. She just done all this on Friday.
Yeah.
She's so perfect in every other way.
I'm gonna play so bad. She just wants to run around and get in trouble. That's what she gives you. She's like, I know you're doing that.
She's so smart. You can't get one over on her.
Stops her panting and like looks at you.
What do you think? Are you making friends, Cricket? Huh?
She's like, they need to play with me.
Aww.
Thing.
What's he doing? What's he doing? Say hi, Mommy. Say hi, Mommy, Chrissy and Daddy Gary. Say hi. She's I look at you all the time. I need to look around and see what else is going
You
on.
have to blow on her.
Oh yeah, I do that to pictures.
That look she gives is so good.
She's like, hey, would you quit spitting at me?
She's like, I will get you. I will lick you to death. Then you'll see what's up.
She's so cute.
Nice sweetheart.
Alright, dogs with isolated tricuspid regurgitation may be asymptomatic for years. It all comes down to Epstein.
Same thing that you just had
Yeah,
said.
pretty much. I just wanted to see if...
More or less the same thing as if she doesn't have that, she could live a long time.
Oh yeah, and perfectly normally, without any surgery. I guess this one indicates that there has been a surgical corrective attempt, and how successful it is.
It was successful?
Yeah, I don't know how much it was. Here's
Okay.
Epstein's anomaly, 158.
Oh, she got hiccups now?
I guess she gets hiccups
had 'em
ever so
earlier.
often.
Yeah, she's earlier coming here.
Poor thing. You make such a
You got hiccups? Say, I love the camera. I love the camera. You give kisses.
Go ahead and flip the lights off here, please.
Now, is that in slow motion now?
Yeah, I'm panning back through the movie clip in slow motion.
Looks like a gremlin.
Go ahead and put the lights on again, Melanie, please. Yeah, this is the same thing. Distinct differentiation from tricuspid valve dysplasia may be difficult, flattening of the head. So it's really, really hard to say. It's a very subjective call. Just want to see if there's any new data that might be something of value.
Okay.
Now, Google it.
Okay.
And see. Sometimes the internet will have some decent information.
Okay. And then you're sending out to the other cardiologists.
Yeah, we'll put it out there and see what anybody else says. It doesn't look like it to me.
That's
because
good.
Usually the valves are the displacement of the valves or abnormal placement is usually fairly obvious.
Okay.
But it is. That's all the
so they're where they should be. They're just not working
seem to be
correctly.
All our best textbooks say the same thing.
Okay.
Hard call to make. Hard to distinguish between one and one plus the other.
So really, unfortunately, the only way to find out is if she lives to her year-old birthday.
And I want to re-echo her probably every 3 months.
Okay.
And we'll just repeat it. I want to see for progression. Treatment is a little tricky with these two.
Right.
At least according to these two references, they talk about, because it's a disease where, it's an output state disease where she's passing out and getting weak because of low output. And most of our treatments are geared at reducing output. Okay. So we're usually using vasopressors, vasoactive medications that regulate blood pressure, enalapril, benazepril, all these drugs that we primarily treat heart disease with, lower blood pressure. And when we have output diseases, especially when that is our main symptom, it can be very hard.
So you don't even know what drug to use that would be the best for her?
It's going to be tough. We
and
might
her
be able
age,
to use some of the newer drugs like pimobendan.
Okay.
And those types of things. But we'll see also, with her degree in symptomatology, we'll see, if anybody's had some success with those drugs.
Okay.
And again, this is such a rare condition in boxers. Again, as the book says, it's mostly a retriever breed disease.
I told my best friend here that I could literally write a book on boxers.
Yeah.
Anything that's had, unfortunately.
This is weird. It's very rare that I'll not be able to give you all the answers that you're asking the questions of. I can't. I don't know.
It seems like it's very little data on it.
In 20 years, I have seen one Epstein's case, and it was fairly obvious.
Yeah.
So, I don't have a lot of clinical experience with the disease or in the management of it. Mm-hmm. So we'll see if maybe someone else is. I know what I did. Yeah, with the patient that I saw. It was probably 10 or 15 years ago that I saw it. It's been a long time since I've seen it.
Oh, wow.
Is we'll see, and I want to see if anybody else has had more recent success with some of the newer medications. And we'll just see. I want a consensus of opinion before we were.
Oh, absolutely.
We'll see what they say.
Okay. So probably wait to place her until we get more data back?
If they know.
They know all about it. In fact, that's why I'm taping this too, is to send that to them.
If they know that there's an issue here, I would say if they're willing to take her and they've got someone up there that can monitor her, then
they have a really good university up there. They're in Ontario.
Oh, so Guelph, isn't that in Ontario, Guelph? That's a vet college.
I think so. It is a vet college.
Yeah,
she did tell me they have a really good vet college up there.
Let's just let them take it and see what they think, too. Place her and let them know. I mean, it's not subaortic stenosis by any means.
No, not with a flow like that.
No, that's just really good.
That's really a dream flow.
Yeah, if it is tricuspid dysplasia without the anomaly, most of the dogs do really well.
Okay. Oh, good.
And she could live a normal, happy life. And if it is Epstein's anomaly, there's no test for it.
Right.
It's subjective. I have a whole case experience of one, and so they probably have more.
Sure.
And it would be interesting to get their perspective on it anyway.
Absolutely.
So it just is a very, very rare bird.
Okay.
And they might not have seen many of it either. You just don't see much of it. You know, she seems to be doing well and feeling good.
She is. She eats.
Yeah.
I mean, she eats fabulous. She's gaining weight. She's happy. She plays.
Yeah.
She's everything. You put all my puppies together, you would never notice that she's any different.
She's an interesting one. The one new drug that might be a lifesaver for her would be like a drug maybe like sildenafil.
Okay.
Something like that would be a very potential treatment option for her because it's a pulmonary arterial vasodilator.
Okay.
And it's a very well-known drug called Viagra.
Oh.
We were going to put, you told me about my Aiden, my Borzoi I had in here. Remember?
Okay.
My Borzoi, the white and black one that was freaking out.
Yeah. That would
so
be.
If he gets worse, that's what you would put him on.
Yeah. Viagra would probably be a decent drug choice for him. But again, I would want to get a consensus opinion before we were.
Oh, absolutely.
Get some university research types to weigh in on it and see. Again, if they feel that pulmonic pressure-wise, there are some pressure differentials that Viagra might help.
Okay.
So that would be.
Oh, that would be excellent.
Yeah. So let's just see what everybody says.
Okay.
We'll put it out there on the for a consult.
What's a normal turnaround time for that?
Oh, it could be up to a week.
Okay.
And we'll see if you know.
Will you contact me, or do you want me to come back in, or make another appointment?
Yeah, no, we don't need. I can do it by phone.
Okay.
You know, just you know, we'll put it out. Hey, Dustin.
Yes.
We're gonna put this is Crickett. Crickett has. Have you listened to Crickett? Do you have a second?
Yeah, sure.
Yeah, put a stethoscope on her. Tell me what you think it is for a boxer. It does explain the harshness of the murmur, though. The murmur was a little harsher than you normally see with subaortic stenosis.
I remember you told me there was a lot of leakage sound,
yeah,
so you were right on
money.
with that.
That we normally see with subaortic stenosis. We'll see, though. But Dustin trained in cardiology up at Minnesota.
Oh, okay.
So maybe he can send it up to. Do you have a contact at Minnesota?
I haven't talked to him about it. I don't know.
Would he look over a case for you?
We can see.
All right.
Yeah.
What do you think?
Great. Cool. Solid.
Great.
I didn't feel it before.
Yeah, I got it as a 5.
Yeah, well, I didn't feel it.
Yeah.
So.
Turns out to be tricuspid dysplasia. Question mark is it an Epstein or not?
Yeah, I can definitely shoot him a text.
Yeah, I mean, if you can look at a couple of cine loops for us and just give us another opinion.
Yeah, sure.
And see if they've had much experience in treating that with sildenafil.
Okay. Yeah, I can ask him.
Yeah, we'll put it out a couple different ways.
I really appreciate Dr. Randall.
Yeah, of course. This is Dr. Dustin Babler.
Hi, nice to meet you.
This is Peanut, our little Peanuts family. Cricket.
Yeah,
if not, I can try and reach out to U of I too, because they've got.
Be curious. Yeah, I've got a lot of video loops on.
I'm sorry. What's your name again?
Dustin.
Dustin. Hi, Dustin.
Yeah.
And I'm Terry, and my friend Diane.
Nice to meet you.
I have Borzoi. She's got.
So since he just trained there recently, maybe we'll just submit it to them and see what they come up. Because the listserv can be really, it depends on who's cruising.
Yeah.
Sure.
Yeah. So,
if you send it to a particular person.
Talk to somebody directly.
Yeah, and we don't get a phone.
And what
call
about Dr. Mears? Would she know much about this? I know she's a genealogist.
Oh, she's going to know a lot about it, yeah. So, I mean, you could always send this to her and get her opinion on it as well. But, I mean, if she's going to go up to where there's a place like University at Guelph, I would say just let them look at it and see what they think.
Okay.
You know?
Yeah, I talked to Dr. Mears quite a bit in the past.
Yeah.
So, because I had a bitch that, like I said, had the really bad heart disease. So.
Well, let me write this up for you, and then they'll make a copy of it, and then if she's still doing well at a year of age, she probably lived to be a ripe old lady.
Oh, that's
they usually
good news.
do with tricuspid dysplasia. We just don't know. And if I had to give you a my opinion, but I don't think it is.
You don't think
I don't think it's Epstein's. But, it's hard to sometimes.
It gives you hope.
Yeah.
So I'm good with hope.
Absolutely. All righty. You can take her out, let her stretch her legs. We're all done with her.
Wonderful.
And then.